Hey guys, Ashley with Amare. So few resources for you guys. We are located in Elizabeth and Highland Park, New Jersey, and I also offer virtual consults. So if you guys need my help, give the office a call, 732-841-0142, and our scheduling coordinator can help you get set up with an appointment. We also have our online shop. So all the products that I talk about in my videos, those are all in our online shop for you guys to purchase. On our Instagram, Amare Healing Arts is our Instagram. All the products are linked right there in our bio. Also, the online shop is linked, and it's linked in the description box for each video. So you guys can go and check those out. And then we have our online course school, the Post-Op Academy. So all of the things that you would need to know post-op, we are doing online courses for. So things like what kind of massages you need, when you need to get them, who to get them from, how to find a therapist like me, all of that we have online courses for. There are going to be more courses coming out all the time. So check in on that to see what's new and what you guys can learn. If you like my videos, all of those courses are exclusive content. All those videos are exclusive content. None of them are on YouTube. They're all in our courses. So that is amarehealingarts.teachable.com. The link for that is also in the description box, and it is also linked in our bio on Instagram. So I hope you guys enjoy the content. Ashley with Amare. I will see you soon. Bye.
Hey guys, Ashley with Amare. So today we're talking about AirSculpt from Elite Body Sculpture. Super popular, right? So I saw an ad on Instagram for Elite's AirSculpt, and it says AirSculpt versus liposuction. I'm going to show you guys the ad. One thing I want to say, AirSculpt is liposuction. It is surgery. It is not like body contouring or like cool sculpting or anything like that where it's, you know, a quick procedure. You don't have any incisions. You will have incision holes, okay? You will have a cannula, a rod going into your body and sucking out your fat. One of the things that they claim that gets you guys in trouble is that it's minimally invasive or less invasive. I have a whole video talking about the difference between minimally invasive and what that means. But invasive is going into your body, okay? Less invasive, if we're invading something, we are still going in, okay? Soldiers invade the castle, they go in. They're still going into your body. This is still liposuction. So the caption says, never risk it with invasive liposuction. Here's the thing, guys, it's still surgery. It's still lipo. You're still going to have incision points. One of the things they say in this video is that you won't have stitches, that they're not using needles or anything like that, but they're using a cannula still. They're using a rod, which they do say in the video. They are still injecting tumescence fluid, lidocaine, right? And then they are still going in with a cannula and sucking out your fat, right? The cannula may be vibrating super fast, but it's still a cannula. So where you guys get in trouble is they downplay it, saying that it's less invasive. They downplay it, saying that you won't have swelling. Like this woman in the video says she didn't have swelling for 3 months. She is not you. You will have swelling. It is a surgery. They are taking out your fat. How much swelling you have depends on how much fat they're taking out. But the problem comes in where you guys don't take it seriously and you don't get your massages and you don't have a proper compression garment because what they give you is super stretchy like this and isn't actually containing your tissue. So we are going to go into this. I'm going to play the video. We are going to watch the video. Then I'm going to talk about it. And we're going to talk about AirSculpt in general, the procedure, what you need to know. And then we'll talk about the recovery, on how you're going to recover without fibrosis, which, by the way, fibrosis is a complication, okay? Fibrosis, hardening, lumps and bumps, irregularities do not need and is not a normal thing after liposuction. I have an entire course, Post-Op Massage and Finding a Therapist, where I break down the science of fibrosis and how you can avoid it. That link is in the description box, it's in our bio on Instagram, it's in all the places. But we're gonna watch this and we're gonna go through it. Because the most important thing is, you guys, it's not about not getting it done at Elite. If you want to, you should. Honestly, it is quick, it is easy, but it's still surgery. And the problem isn't the surgery, the problem is you guys don't take care of it properly afterwards. So let's watch this video.
through traditional liposuction. This was like swatting mosquitoes off my body versus an actual surgery where I had to wait for the swelling for 3 months to go down.
You're having a minimally invasive body contouring procedure. We're actually removing your fat, but we're doing it while you're awake with no needle, no scalpel, and no stitches.
I never had an issue with any of my entry points. The ones in my pelvic area, like gone.
Instead of needles, which no one likes, we use a jet injector. It uses compressed air to drive lidocaine through the skin. That allows you to create a hole with a 2mm biopsy punch. This cannula is moving so fast, it actually helps tighten the dermis.
I just honestly woke up the next day and went right back to my routine.
What's incredible about AirSculpt is it achieves very, very dramatic results that are smooth and natural with almost no downtime.
What I remember looking like, I don't know that you can put a price on.
All right, so no downtime, no stitches. Sounds like it's not surgery, right? Guys, it's still surgery. We're still going in there. We're still taking out fat. There are still puncture or entry sites, as they say. You are still going to have incisions. Just because they're not stitched doesn't mean they're not incisions. Are they smaller? Yes. Are you going to maybe be leaking from those things? Yes. This is still surgery. They say it in the video. They make it seem like it's not, and that's where the problem is. So this person says she was back to work the next day. I've been doing this for 9 years, okay? I see at least 2 brand new AirSculpt people a week that come in, that need help, that are a month out, that are 2 months out, that have fibrosis, that don't have a proper garment, that have all these issues. Skin irregularities, skin being, puffy and saggy. If it's not fibrosis, then you say it doesn't work, which I just did a whole video on why the liposuction doesn't work. You say it doesn't work because you're still swollen 3 months out and it looks like there was no work done. This is still surgery. Guys, I cannot say this enough. It is still surgery. So, what do we need to know? The swelling, first of all. Depending on how much you get done is going to depend on your downtime. Okay, so if you are having a little bit done, that's going to be, less downtime. If you are doing 360, which means all the way around the body, pubic region, bra roll, and everything in between, or thighs and arms and all the other stuff too, it's going to be a lot more downtime. It's going to be a lot more swelling. It's going to be a lot more massages. Excuse me, massages. So we need to understand the magnitude of the surgery that we're doing. Just because someone does chin lipo, or maybe they do ab lipo, and it's just a little bit, and they heal within, 6 weeks, right? And they don't have any swelling. They did this much of an area. If you're going to do your whole body, you're doing this much of an area. You're going to have this much more healing to do and this much more swelling versus this. So the key to understanding this is, one, it is still a cannula going into the body. They're going to make a hole. They're going to inject that numbing solution, the lidocaine, all of that, the tumescence fluid. Then they're going to go in with a cannula, a rod, and suck your fat out. They're taking out tissue. So your body is going to go through those 4 phases of wound healing. It's going to go through the bleeding phase for the first 3 to 4 days, and then it's going to go through the swelling phase for the first 4 to 6 weeks, and then it's going to try to start making new tissue. If we're not getting that swelling out during that second phase of wound healing, and we don't have a proper garment to close that space so it doesn't fill up with excess swelling, and we don't have lipofoams, and we don't have any of the things we're supposed to be doing, and we're using a board, which is not for liposuction. Boards are not used for healing liposuction. I'm going to say it one more time. Boards are not for liposuction. Okay, boards are for abdominal support after a tummy tuck, not for liposuction. You cannot squeeze and squish and do all of those things with a board. You need lipofoams. If you don't know where to get lipofoams or anything about lipofoams, or if you have lipofoams and they're not working, go to our shop, amarepostopshop.com. Watch the video on the lipofoams. Anyway, all of these things that you're using or not using is where everything goes wrong, right? So when we're talking about healing from any kind of liposuction, especially AirSculpt, you need a proper garment. I have seen way too many times that you're just in whatever they give you and you believe what they're saying, that, oh, it's minimally invasive, it's no downtime, you'll be fine. Give it, 2 or 3 days, give it like 2 or 3 weeks, you'll be okay. And you're not okay. That's the problem. And then you don't know what to do because they're not telling you what to do because they say it's minimally invasive. They say it's just, a small procedure and that's it. It's still a procedure. So we need proper lipofoams. We need a proper garment. Garments are not meant to squeeze. They are meant to contain. They should be firm and comfortable. You should not be like having a rubber band around your body. We need massages, okay? Manual lymphatic drainage, not the Venus Legacy laser, not radio frequency, not cavitation. Save all of that stuff for like 3 to 6 months out when you have no swelling and no fibrosis. If you still have hardness, lumps, and bumps, if you still have swelling, if you're still having healing issues, none of that stuff should be done. The only thing that should be done is the gentle manual lymphatic drainage to address the swelling, because fibrosis is an aggravated, compressed, dehydrated, stuck, clumpy form of what swelling should be, which is squishy so you can pee it out. So when you go in there, let's say you've had it done already, like everyone who finds me, let's say you've had AirSculpt done already, right? And you are at your 6-week mark and you go to your follow-up and you're like, I have all these lumps and bumps. I still feel like I'm swollen. I don't understand what's going on. And they're like, oh, well, give it time. It'll go away. Don't do that. Find yourself. First of all, I do virtuals. So if you've had this done and you're not in New Jersey, you can set up a virtual with me and we'll get you on the protocol and figure out what you don't have and get you what you need. Second of all, don't wait, because that second phase of wound healing, if you leave that swelling and fibrosis, it will get worse and it will become permanent. Let's say your lumps and bumps do go away, but you're going to wind up with that swelling and then be like, oh, well, the lipo didn't work. Well, AirSculpt didn't work and now I need round 2. Or you listen to them, you go back at your 6-month follow-up and they're like, oh yeah, we can go in again and we can get some of that out. Well, it shouldn't have been there to begin with because it was swelling that had proteins in it that became fibrotic, and then those proteins and swelling became, permanent, and now is in there and stuck between the tissue and the skin. So they say there's no downtime, which you're gonna be swollen, you're gonna be in pain, you're gonna be in a garment. They say that it's minimally invasive. It's still invasive. It is still surgery. You're still gonna swell. You're still gonna need to heal. They say that you're not going to have incision sites, or they say you're not going to have stitches. They talk about entry holes. You're still going to have those little holes that need to heal properly. If you are swollen and you leave the swelling will push on the back end of those holes, right? Those incision sites, and keep them open and make them scar really bad. So part of that is making sure you have a proper garment that's closing that space. Part of that is making sure you're getting your manual lymphatic drainage massages, this gentle pumping motion. That's it. That's what it should be like. It should be this gentle pumping motion to move and stretch the skin. That is what you need after AirSculpt. And every AirSculpt office is different with their massages because you're talking to a nurse. And this nurse is going to have different experiences, is going to know different things. Some of them may tell you to get your massages. A lot of them don't. A lot of them tell you, oh, you'll be fine. Just wait. It's okay. Or they'll be like, oh, we can do your massages here. And it's somebody just rubbing you with oil, which is not going to get the swelling out. Or it's going to be really painful when they do the massage. Or they're going to use some sort of machine. None of that is going to work for what you had done. You need manual lymphatic drainage. You also need a proper garment. The garments they give you are very, very stretchy and very elastic, and they will give you a smaller size the seams of it will cut into you, but the actual garment will not contain anything. And sometimes I mess around with the garments, guys. I've seen some crazy things. They'll give you your first garment and it'll have hooks. They'll give you your second garment and it won't have hooks, and it'll just be like a pull-up situation, like a Spanx thing, and it's like cutting and digging into you and it's not really holding anything back. And again, they say there's no downtime, which I don't understand. But one of the other things that I want to address in this is when they talk about, the skin tightening part of it, right? You have to have a conversation with them as far as how much skin is actually going to tighten. Because I have seen where people go in and they're like, oh yeah, there'll be a little skin tightening to it. And let's say you just have stretch marks. You don't have actual loose skin. You have stretch marks. And then you leave the swelling. You don't do any massages. You're not in a proper garment. You're not taking it seriously because they don't make you take it seriously. And then your skin is like pudgy and squishy. And you're like, well, I thought there was skin tightening to this. I don't understand. There is a difference between the actual getting like a tummy tuck or skin removal where you have enough skin to do that and having loose skin. There's a difference between having hanging skin and loose skin. That is something you need to address with the surgeon in the room when you go to get this done to make sure that you are understanding what needs to be done and how it needs to be done. Because yes, although it will tighten up and firm, it will firm the skin a little bit, it's not going to fix an excess skin situation. You may still have loose skin. You may still have hanging skin. The whole skin situation, if the doctor says, if the surgeon says, oh no, it'll tighten up, you'll be okay, your skin has good laxity, then what you're seeing, your skin not being like tight and firm like this to your body, that's still swelling that's in there that's making you look pudgy. If that is what the surgeon said, this is why I'm bringing this up. You need to speak to the surgeon about the skin situation. Now, there's nothing wrong with having loose skin. If that's okay for you, then that's okay. There's nothing wrong with that. I have clients all the time that get lipo done because they just want the lipo. They don't want to go through a whole skin removal process. There's nothing wrong with that. I actually have a couple before and afters on my Instagram like that. And people are like, oh, well, her results look terrible because she still has loose skin. That's what she wanted. That's what she wanted. Leave her alone. So there is nothing wrong with that. If you have a little bit of loose skin, you want to go and address it later, that's totally fine. But again, don't misunderstand this little infomercial for thinking that it's going to do miracles for tightening your skin all around. That is something you need to talk to them explicitly about. Now, back to the aftercare. They know nothing. Guys, they know nothing. They are there to do the surgery, okay? You don't go get a knee surgery and your orthopedic surgeon starts giving you PT exercises or teaching you how to wrap and do wound care for your knee. That's not their job. That's the nurse and the PT. Same thing with surgeons. The aftercare, they don't know anything about. They're not certified compression garment fitters. They don't know how compression works. They just know that you need to be in compression. So they're not going to be able to tell you how that whole thing is supposed to go. That's my job. The other thing is the massages. They know nothing. Guys, don't, and this is why I'm doing this video, because you come in and you're so mad. You are enraged after you get this done and you're like, this is crazy. They said there'd be no downtime. They said there wouldn't be all of the stuff I needed to do. They said I would be fine. Or you find me like 6 to 8 months out. And you're even more mad and you're done with them because you went to your follow-ups and they kept telling you it was going to be fine and it's not fine and you know it's not fine and it doesn't feel fine and it doesn't look fine. Or it does look fine, but it's extremely hard and flat and fibrotic, but hard and you can't breathe, you can't move, you're still having pain, all those things 6 months out after this. And you went to your follow-up and they're like, oh, it'll get better, don't worry about it. And you're like, all right, whatever, dude. And then you find me and I explain to you the science of how all of this works. And then you're pissed. And then you are pissed and you are angry and you're like, well, why didn't they tell me? Because they don't know. Because it's not their job. Because it's my job. Because they're not educated. Well, they should be educated. Well, they're not. I wouldn't be doing these videos and I wouldn't be seeing as many of you guys as I am if they were. So be aware that this is still surgery. Be aware that although you don't have stitches, you will still have incisions. Be aware that although they say it's minimally invasive, it is still surgery. There is still a cannula going into your body and taking out fat. Be aware that you are still going to swell. You are still going to have to heal. You're still going to have to be in a garment. You are still going to have to get your massages. And if you don't, you will be fibrotic, you will be swollen, you will be in pain. It'll look like no work was done. You'll still have, let's say like chin lipo, you'll still have like some hanging skin, some chin lipo, like bubbly double chin situation going on, and be like, oh, it didn't work. And then they'll tell you, oh, well, you could do like this, machine, or we could do some tightening, or we could do this, or we could do that. It's just because you didn't heal properly from the surgery. That's all it is. So being proactive about this, it is not a bad thing. So this is really all I had to say. So let's like wrap it up, right, in a bow, because bows. Elite AirSculpt is still surgery. You will still have incisions. You will still have swelling. You will still need a proper garment. You will still need manual lymphatic drainage and no other massages for the first 3 months. Those are the massages you need. It is still going to hurt afterwards. You are going to have fat taken out. Your body is still going to need to heal. Yes, it is less invasive, but they are still going into your body with a cannula. No, they don't know anything about aftercare. No, they are not going to tell you to go get massages. If you're lucky, you'll get a nurse who tells you. No, their garments are not the greatest thing in the world, but they are good for right after surgery. But then you need to get a proper garment, and you need to get foams, and you need to get wound care, and you need to get the post-op cream, and you need to get proper soap so that your incisions and your skin heals properly. All of those things you still need to do, just like regular liposuction. There is no difference other than it is quicker. It's a different type of cannula. It's a different cannula, meaning the rod that goes inside of you. It's a different kind of liposuction, but it is still liposuction. Yes, it is not the same as traditional liposuction, where they're using, well, even still, because there's Vaser, there's water assisted, there's power, there's so many different kinds of liposuction, guys, like a million different kinds. This is just another one of them. So TriSculpt is Sonobello. AirSculpt is Elite. They call it tons of different things. Vaser is another kind of lipo. Water assisted, power assisted, all of these different things. It is still surgery. It is just a different type of liposuction, a different machine that's being used, a different cannula, a different way of doing surgery, but it's still surgery. So there is nothing wrong with getting lipo from AirSculpt. I have seen, after we get through the fibrosis and the swelling and all of the botched post-op care of it, or lack of post-op care, I've seen amazing results, quick results, amazing results come out of Elite from AirSculpt. If you're going to do spots like your arms or your chin, or just a little bit on the flanks, a little bit on the stomach, a little bit on the brow roll, a little bit on the back, if you're doing that, it's going to be quicker with healing. If you're going to do like a full all the way around thing, because we're talking about price and it's cheaper than doing other kinds of, liposuction with a different surgeon, you need to be so on top of it with your post-op care. You need to find me before surgery or right after, and we got to get you on a protocol, and we got to make sure your garment's okay, and we got to go step by step, because they're not going to tell you how much water to drink. They're not going to tell you what foods to avoid. They're not going to tell you how swelling works. They're not going to tell you what you're doing that's causing more swelling. All of that stuff is me. All of that stuff is in our post-op course. If you guys are planning to get AirSculpt by Elite, get the post-op course, because I talk about how fibrosis is made. I talk about garments. I teach you how to find a therapist. And more than that, I teach you how to guide your therapist, because not everyone is as deep in the post-op part of it with manual lymphatic drainage as I am. So having the understanding of how manual lymphatic drainage works, you as a client, is going to be extremely helpful to your therapist that you wind up seeing. Because you can find a certified manual lymphatic drainage therapist, that's easy, but getting someone that knows what they're doing as far as how to reroute the fluid, how the garments work, how you're supposed to be wearing your foams, how many times you're supposed to be going a week, all of that, you're going to need to tell them. Because we're not trained for that in school. All of this is my years of experience and all the plastic surgery textbooks and doing post-op for so long. You are going to need to guide them as far as, okay, I had AirSculpt done. I had a little bit of fat put into my glutes. I can't lay. I need to be supported. Or I can lay this way. I can't lay that way. They're not going to be able to tell you all of those things because they're not trained in it. They don't know any of those things. I do all this research for you guys so I can help you guys and then share these videos for that reason. So the main point of the course, and the reason you need to get it if you are getting AirSculpt, had AirSculpt, you're going to Sonobello or Elite, is to be informed so that you understand, okay, we actually have a lymphatic map, right? This is how the body drains fluid. Your therapist should be addressing certain areas first to be able to get the fluid so that you pee it out back into your body. Okay, if they're not addressing certain things first, like the major lymph node sites and the drains, the fluid's just being pushed around in your body. It's not being reabsorbed. And that's why I say hold off with all other kinds of massage, because all you're doing is pushing fluid around and congesting your tissue that's trying to heal. Manual lymphatic drainage is decongestive therapy, where your body absorbs the fluid and pees it out. And I teach you guys about that in the course. So the point of it is for you guys to understand how the lymphatic system works and how swelling works after surgery. So when you do find a therapist, which I also help you guys do in the course, I have links to schools for you to find a therapist, directories, and I teach you what credentials to look for to know if they're certified. Even if you don't find them through the directories, but you're looking on Google, I teach you what letters they should have after their name as far as training, or what training they should have to be able to know how the swelling works and how it can get out of your body, especially after something like this, because we need to be able to reroute the fluid, not just massage you, but actually scientifically, like open up certain vessels and open up certain areas in a certain pattern in certain pathways, which you guys will learn in the course so that you know your therapist is doing it right. And let's say your therapist is manual lymphatic drainage trained, they need you to tell them, okay, this is the area I had surgery. This is where it's congested the most. This is what's going on. But you need to understand how the body works as far as swelling and manual lymphatic drainage in order to know what to tell them. Because you could tell them, yeah, I had surgery, I'm swollen on my abdomen, and then they're just going to rub you. And you don't know if they're actually addressing the major lymph node sites in the proper way, and if that swelling's actually going to go out, or if it's just feeling good because they're rubbing you. So that's kind of the major point of it, is for you guys to understand and be educated and informed before you go to somewhere like AirSculpt, to know what's going to happen to your body during surgery. The course teaches you all of that. How, the swelling works after surgery, what you're doing with the garments, why you need them, what they're supposed to do, common mistakes that are made after liposuction that cause swelling, the things that you need to tell your therapist, and when you find your therapist, make sure that they're doing correctly so you know that the swelling is going to come off of your body properly. Because you can find someone on Google, they can say they're certified all the live long day. You get in the room with them, they break out the CBD oil and start rubbing you. That is not manual lymphatic drainage. That is not following that map. That is not following how your body is designed to work. So part of before you go to AirSculpt is one, this video, understanding that it is still surgery, understanding that you are still going to swell just because one person, and we don't know if she had her whole body done. We don't know if she had 3 liters of lipo. We don't know if it was just one area that she did, one tiny little patch that healed in like 2 weeks and she had minimal to no swelling. We have no idea. She is not you. She is not your body. She is not your surgery, and she is not going to heal the way that you are. So you need to be informed. And you need to talk to your surgeon when you get to AirSculpt about the downtime. Because although this ad looks great and it's minimally invasive, your surgeon's going to be the one doing the surgery. They're going to know how much they're taking out of your body. They're going to know how long it's going to take for you to heal about with how much work they're doing. It's not always a one size fits. It's actually never a one size fits all when it comes to healing afterwards, because the surgery is never one size fits all. Anywhere from half a liter in one area all the way up to 3 liters, 4 liters in several areas all the way around your body. The more you get done, the more you're going to need to heal, the more important it is for you to make sure that you have proper garment, proper foams, proper manual lymphatic drainage, proper diet, drinking enough water, all of these things, taking care of your incisions, being on top of it so that you do heal properly. So that's pretty much it, guys. I saw that ad and I was like, oh no, so many people are going to have so many questions. So make sure that you are informed. Go get the course. And I would, like I said, there is nothing wrong with AirSculpt. I think it's great. I think it works. I think the problem comes in is that you guys don't take it seriously, because their marketing makes it seem like it's not that serious, which it absolutely is, and you need to take it seriously. So just like you would prepare for any other surgery, just like you would do research for any other surgery, do the same thing with AirSculpt. They are pretty reasonable as far as price. They are pretty easy as far as getting in there to book, and the results are great, but the results depend on you and your aftercare. That is where your results come in. So I hope this was helpful. I know I just kind of went off for 28 minutes. I hope this was helpful. If you need to purchase the course to understand how to direct your therapist when you're getting manual lymphatic drainage, to understand what's going to happen as far as healing and swelling during this AirSculpt procedure, it is Amare Post-Op Academy. But the link, we offer payment plans for the course. It's $150, but we offer payment plans through Shopify for it. So if you just go to Amare Post-Op Shop, actually the link is in our bio for the course directly on our Instagram, but amarepostopshop.com. The course is on our shop, as well as all the supplies you're going to need for your lipo. If you need me, if you need help, if you are getting AirSculpt and you're terrified, if you are after AirSculpt and you're terrified because you have all these things going on, call the office and set up a virtual with me, 732-841-0142. Or if you're in New Jersey, come and set up an appointment with me in person, and we can actually work on you and get you all your supplies and get you set up and do everything that you need to heal from this. So that's the same number, 732-841-0142. Our scheduling coordinator can set you up with either a virtual if you're not in New Jersey, or set you up with an in-person session in Highland Park or Elizabeth with me. The foams that you need after surgery, the lipo foams, they are on the same shop page, Amare Post-Op Shop. The detergent for washing your garment in foams to make sure that when you bleed on them, they're getting cleaned and disinfected properly. The medical grade detergent, that is also on there. You also need that. That's pretty much it, guys. Just don't let them mislead you into thinking this is not surgery. Don't let them mislead you into thinking you don't need to take care of this, because it's not the surgery where it goes wrong. It's the lack of care after surgery. It's the lack of attention to the swelling. It's the lack of massages. It's the lack of proper garments. It's all of the things that are getting in the way of you healing that's getting in the way of your results, not the surgery itself. So that's the end of that. Ashley with Amare. I will see you guys very soon.